Dr. Shannon M. Clark here. I am a double board certified OBGYN and maternal fetal medicine specialist, and I'm coming to you today with a very important message or thought that I have. And that is that I am convinced now more than ever that one of the biggest threats we have to maternal and pregnancy care is social media misinformation. The amount of blatant medical misinformation targeting pregnant individuals is alarming and concerning. And here's just one example. This post called The Scam of Preeclampsia. Let's see what they have to say.
I'm allergic to scams. Seriously, this is not new. It's been disproven. It's a joke.
Now, who would post something like that? I just had to know. And this is a post that has a decent following, who is a birth keeper. No medical training, does not do any kind of clinical care for anyone with a fetus in the uterus. But they're going to tell you that preeclampsia is a scam. She goes on to say, preeclampsia is not a condition. It is only a label signifying that a woman may have one or more markers which may turn into the actual condition, eclampsia. Well, preeclampsia is actually a disorder. It is a disorder of pregnancy associated with new onset hypertension, which occurs most often after 20 weeks of gestation and frequently near term. It's also a hypertensive disorder of pregnancy, which is one of the leading causes of maternal and perinatal mortality worldwide. And actually, preeclampsia does have definitions and diagnostic criteria. You can have gestational hypertension before preeclampsia, then you have preeclampsia with severe features, preeclampsia without severe features. They can go on to HELLP syndrome, and then on to eclampsia, and then something called PRES. So there is a different level of severity of the disease, but it is a disease and a disorder of pregnancy. It's not a condition, and it's not only signified by one or more markers. We have definitions and we have diagnostic criteria. And the whole purpose of diagnosing preeclampsia is to A, get the diagnosis, B, know where the patient falls on that spectrum, and C, determine when and how the patient should be delivered to get the best maternal and fetal outcomes. And also to D, prevent the patient from going into eclampsia, which is an obstetrical emergency, or getting more severe disease like HELLP syndrome. They go on to say how many women are told they have preeclampsia and then been fear-mongered into ending their pregnancy before the baby is ready to be born. None of this is explained to them. No solutions are given except for induction. That's because we determine A, how severe the disease is, the hypertensive disorders of pregnancy, what the symptoms of the patient are, the status of the fetus, what gestational age they are, before determining when they need to be delivered and how they need to be delivered. The truth is that the signs and symptoms of preeclampsia have many solutions, which are easy solutions. Doctors either don't know this or don't share because they'd rather a woman schedule an induction anyways. The only solution to preeclampsia is delivery, period. Also, Pitocin elevates blood pressure, so an induction is literally the worst thing that can be done into a woman with preeclampsia. In fact, I have her suspicions, that induction actually causes a true postpartum symptoms of eclampsia. This is absolute horseshit. Absolute horseshit, and it is dangerous to have anyone putting this crap out there to pregnant individuals. I cannot believe that this account is even allowed to be on any form of social media. So then she gives you a list of things to do to prevent getting delivered for preeclampsia. And none of this is going to change the diagnosis. You need to rely on people with medical training who actually care for individuals with these hypertensive disorders of pregnancy for accurate information. Now I want to close this with a couple of things. When you have a diagnosis of preeclampsia, you need to know how severe it is, take into consideration with the gestational age for determining whether or not delivery is indicated at that time, or if expectant management can occur. And there are cases where expectant management can be done. Next, preeclampsia is not a scam. It is a true disease of pregnancy, and it is a very serious one. In fact, 16% of maternal deaths can be attributed to hypertensive disorders of pregnancy, including preeclampsia. An account like this, talking about the scam of preeclampsia, when in the United States, Black pregnant individuals are at increased risk of having preeclampsia, having severe morbidity from preeclampsia, having mortality from preeclampsia, and also losing their fetuses from preeclampsia, is absolutely egregious behavior. If you have any additional questions about preeclampsia, please put them in the comments on this video and I will try my best to answer them.